Hi folks, Timothy Brown here, your host of Profit Practice TV. Thanks for tuning in once again. Today I want to talk a little bit about patient count. Something that's very common in the industry is that practice owners horribly overestimate the number of active patients they actually have in their practice. There's still no industry standard on what an active patient is. That could be someone who has appointed in the last year for an appointment or the last 2 years. Generally speaking, it looks like the industry is starting to concur that if a patient has appointed once in the last 12 months, let's call them active. Any kind of appointment, any kind of treatment, they've been in the office, something occurred, let's call them active. Now, when we look at the number of active patients in a dental practice, there's many methods to determine it, but one of the easiest ones is total dentist and hygiene hours in the practice. For example, the average dentist works about 1,500 hours, and the average full-time hygienist might work about the same, 1,500 hours. So that means those two providers, if there were only two in the practice, work 3,000 hours a year combined. 1,500 doctor, 1,500 hygienist, 3,000 hours. Now, the average well-educated patient will appoint to their dentist about twice a year, usually for 1 or 2 cleanings, maybe some other type of treatment. So a good active patient would show up twice a year. So if we had 1,500 active patients in a practice showing up twice a year for about an hour per appointment, remember these are broad averages, 1,500 patients twice a year for an hour is about 3,000 hours. So the equivalent full-time dentist working 1,500 hours, the equivalent full-time hygienist, and that could be one hygienist or 2 half-time hygienists, but it's 1,500 hours. We're talking hours here, not people. 1,500 hours doctor, 1,500 hours hygienist, 3,000 hours total time. 1,500 patients come twice a year, 1 hour each, 3,000 hours. That's a pretty easy number. 1,500 active patients would be the number in that practice. Now, there's emergencies that come in, there's quick visits, there's longer sittings, there's many exceptions, but using simple averages, the average equivalent full-time dentist with the average equivalent full-time hygienist being 1,500 hours of chairside time, and remember, we take away lunch hours in office hours, we don't count lunch hours, 1,500 active patients. So we had a client recently who worked about 1,300 hours a year who insisted they had 5,000 active patients. So I explained to the doctor that 5,000 patients coming twice a year would be about 10,000 hours of doctor and hygiene time. And the doctor worked 1,300, and there was about 1.5 equivalent full-time hygienists for about 1,900, 2,000 hours. So they only had about 2,400 hours of production time in the practice. There's just no way 5,000 patients could be seen on that kind of hourly schedule. A real simple way, talking about active patients, using production hours and average patient sitting time and visit time to work your way back to average patients. What I'd like to conclude is that most dentists horribly estimate the number of active patients, and when a patient count is done by most buyers, they come in substantially lower than what most owners say, and it has a great deal of, it really can upset a transaction and has a very high probability to kill a deal. So don't overestimate your patients. There's no point in doing so. Most appraisers and business analysts use income as an indicator of value and other methods. Using patient count to indicate value is quite frankly patently flawed, and to overestimate your number of patients thinking it'll get you a higher value, it's not going to fly because that will fail in the end, usually at the due diligence stage where the buyer comes in and decimates the number the owner provides, embarrasses the appraiser in the progress. It happened to us recently, that's why I'm recording this video, and the deal dies. Patient count. Important stat in dental practice appraisal, important stat in dental in selling a dental practice, but don't overestimate, doctor. Don't overestimate. It's not going to get you anywhere. I'm Timothy Brown, your host of Profit Practice TV. Thanks for watching.